All right, at exactly 4 minutes past 9 a.m., Health Tuesday is the segment that is on air right here on Good Morning Kenya, and my name is Vivian Ndegwa. Now, infertility is a sensitive topic that is often overlooked, but going by the statistics, whereby 1 in every 6 people globally suffer from infertility, and right here in the country, 1 in every 5 couples are struggling with conceiving. It is clearly a topic that we need to dissect. And joining me in studio yet again, since last week we got disrupted, is Dr. Mohamed Ali Hassan, who is a consultant obstetrician and gynecologist. And joining us for the first time is Dr. Rajesh Chaudhary, who is the lead IVF specialist, Fertility Point, Kenya. Welcome to the studio, gentlemen.
Thank you.
Okay, if we may just begin by defining what infertility is, Dr. Mohamed.
Thank you very much. So infertility is the failure of a couple who at their reproductive age, following sexual intercourse, unprotected sexual intercourse, without using any contraception within a period of 1 year. That is failure to conceive within that period of 1 year. But the duration is shorter for women who are above the age of 35, and the ones whose cause of infertility has been discovered.
Okay, now that you mentioned cause of infertility, if Dr. Rajesh, you may get into some of the causes of infertility.
So infertility cause depends on the age of the patient. So in men the causes are different, and women the causes are different. Let's talk about the men first. So the most common cause of infertility in men is that could be, sometimes it can be genetic, where the genes in the Y chromosome can be disrupted, leading to either azoospermia when there is no sperm at all, or there can be very low sperm count. Then there could be a cause of like anatomic cause like varicocele or undescended testes. There can be sometimes a childhood infection like mumps, which can lead to, or orchitis, which can lead to like infertility in men. Then recently there may be a lifestyle, like some hormone disruptors like phthalates and bisphenol, which we get in the plastics. So these consumptions in chronic time, it can lead to infertility.
Okay.
So extreme obesity, like when someone is, the weight is very, BMI is high, so and then there is a fat in the body, so that lead to the accumulation of estrogen in men. Now estrogen is a female hormone, and that suppresses the testosterone, which can lead to again infertility, so low sperm count. So these are some causes of infertility in men. In women, it is a bit different. Again, a hormone causes are there, like PCOS, a very premature failure of ovary, where the egg production comes down. Again, genetic is a bit common in women as well. Like when the X chromosome, the gene in X chromosome is disrupted. Then the tubal factors, like when the tubes are infected or blocked, or say the uterus factor, when there is a fibroids or adenomyosis, that can lead to, that can disrupt the process of implantation. So these are some common causes of infertility in men and women. But there other cause is age related. Like someone can be fertile at the age of 20 and 30, but when they wish to get pregnant at 40, then there can be a problem.
Okay, so what exactly is the appropriate age biologically for one to try get a baby? Until what age is appropriate?
Yeah, so it's all related to the egg quality in women. For men, the perspective is different. The age effect in men is a bit late, say after 45. There can be a DNA damage to the sperm. But in women, the best time to get pregnant is before 32 years.
Okay.
So that is because after 32, the quality of egg starts declining. The quality and the number of the egg. And then she may have to struggle to get pregnant.
Okay, so men also have a biological clock. We always assume that it's only women who, you know, should rush with that biological clock. But as you've said, from the age of 45, a man's sperm quality has also gone down, so they may not be as fertile as well.
Yeah.
All right.
So even men experience andropause, like women experience menopause. Even men experience andropause.
Okay. All right. Dr. Mohamed, if you may just get us into some of the causes of that may cause the sperm quality to go down.
So there are a few issues. First of all, we could start with age, which could cut across both genders. That is above the age of 35. There's a decline in quality of sperms. There's a decline in quality of eggs. There is also issues with unhealthy lifestyle that is now going into drug abuse, going into excessive alcohol drinking. There's issues with smoking. There are chronic illnesses. Having issues with diabetes, poor control. Then there are autoimmune disorders also that could interfere with the quality of your sperms and eggs. And for the weight, the obesity also is a major contributing factor. For the ones who have a high BMI, they have difficulty achieving pregnancy, or rather like conceiving.
That's for both men and women. That is some of the factors that affect the egg quality and also the sperm quality.
Yeah, and also occupation-wise, the environmental factors, being exposed to ionizing radiations, especially if you're working in radiology department for long.
Are there any symptoms of infertility aside from one just trying to conceive and they don't conceive? Are there any other symptoms maybe?
Most of the time there is no symptoms, but when you have like for women, if she experiences like hot flushes or say there is a severe abdominal pain during menstruation, that could be a sign of endometriosis. Or say abdominal pain, severe abdominal pain, not only during the menstrual time also. Or for men it could be like if there is a erectile dysfunction or if there is a pain during ejaculation. So, but these symptoms are not experienced by majority of the infertile couple.
So when does one go for a fertility check, and where does someone go for this checkup?
Yeah, so if a couple is looking to get pregnant, and if they are trying for 1 year without the use of contraception, and if they are still struggling to get pregnant, then they should start looking for a fertility center or any gynecologist at the beginning. So even a gynecologist can offer the basic infertility services, where they can go and have a basic test like a semen analysis and ovulation check and a basic ultrasound for women. And then that can help in diagnosis in majority of the case, because a simple test that is a semen analysis can detect 30 to 40% of the time. Like even men contribute for the infertility in 50% of the case.
50% of the cases?
50%, yeah.
That is interesting to know, because most of the times when a couple is struggling with conceiving, many a times they just blame it on the woman. You know, the woman tends to take the blame. So I even had a question where I was asking, is there a gender that is more prone to infertility? And I think you've answered that, because you've said 50% of the time it's the man that has an issue. Kindly get into that. Yeah,
let's get a picture how the infertility distribution is. Like 1/3 of the time it is the female, be it the tubal cause or age-related or fibroids or ovulation problem. And 1/3 of the time it is the men. And 1/3 of the time it is both. Right? Like the husband can have a subtle semen problem, and wife can to have a subtle ovulation problem. So in 1/3 of the time, it is when both couple are contributing to the infertility. So in general, it is a 50-50% when both men and female. Now it's very difficult for men to accept that, maybe because of how the God has made their ego. That's a different thing. But yeah, that's a reality. Yeah.
God. And the ego.
Yeah, but to conceive a baby, a female reproductive organ is a bit complicated. Like there has to be ovulation properly. There has to be a patent fallopian tube where the fertilization process happens, and there has to be a good womb lining and uterus environment where the embryo can get implanted and a healthy baby can grow there.
Okay.
Now, to add on what Dr. Mohammed said in the very first question, what is infertility? Infertility is not just inability to conceive. It's also when you are pregnant but not able to hold the pregnancy. You know, that is also now considered as a infertility. So the uterine environment that after the implantation and that carries the baby for pregnancy for next 9 months. Even that uterine environment, to check that uterine environment is important.
Okay, so infertility is not just someone who cannot conceive. It's also, you know, whereby you conceive, yes, but you're not able to carry your baby to term. That is also referred to as infertility.
Yeah.
Oh, that's interesting to know. So, Dr. Mohammed, I feel like you're a gynecologist,
yes,
right? Not I feel like you are a gynecologist. I feel like ladies get to start seeing a gynecologist from a really, really early age, you know. Young girls as early as 13 are advised to see a gynecologist. How important is that, and why don't we have men also being, you know, asked to, who are they supposed to see first of all?
They are also supposed to see gynecologists for different issues, and also urologists for other issues as well. Okay,
so why is it important for ladies to start that early, and I don't see that being, you know, advised for men or boys as well?
So that is the time when puberty happens, and puberty is when a boy or a girl develop secondary characteristics and physical characteristics, and this is the time, or rather like this is adolescence, whereby the period where onset of puberty is up to the time of adulthood when she attains 18 years of age. So during this time there's issues which happen, especially for the young girls. This is the time when she starts having her menstruations. So she could present with painful menses, or even for the ones who have issues with for sort of hymen, imperforate hymen, whereby there is collection of blood in the vagina and the uterus. So these are reasons why a girl or a boy would come to the facility to have a look at the gynecologist, whereby they could have delayed sexual secondary characteristic, or rather delayed puberty development. So a mother would be concerned as to why her girl who is 16 years of age and has not maybe attained some characteristics. Yeah.
Okay. If you could just touch on maybe some of the societal pressures that couples face while trying to conceive, because I'm sure you have interacted with some of them.
So as a couple, there is definitely expectation of being a parent. Yeah. So at the end of the day, the reason why you two are together is because you want to conceive. Secondly, is because you want to continue with your family lineage. You want, at the end of the day, you have to have that. You want to have that genetic lineage follow. So for some, it is a social norm, whereby it is a crucial step in becoming an adult for you to become a parent. Then there is economic security in terms of whereby when you grow old at the age of maybe 60 or 70 is when you want your child maybe to take care of you. Then there are issues of also social comparison. in that you compare yourself with other couples who have already achieved their pregnancies. Then there is fear of isolation in the social circles, in that there are couples maybe who gather together with their children and go out to have fun. So you fear that isolation to happen for you.
Okay, on that note, we'll take a break, but don't you go too far. When we come back, we go on with this conversation. We get to find out, is infertility reversible, and what are some of the options that one may have? We'll be back after this short break. Welcome back, and we continue with our discussion right here on Good Morning Kenya Health Tuesday, which is tackling infertility and IVF. Now, there's a question that has just been sent in. I believe, Dr. Rajesh, you may take this. And they are asking, is it a myth or true that family planning can cause infertility?
99% of the time it is a myth. Why 1% is not a myth? Because sometimes when, if the family planning is IUDs, and if it causes infection in the womb lining, then it can lead to infertility. Otherwise, most of the family planning methods, they don't cause any infertility.
Okay.
So when you come out of that family planning, so after a certain time, maybe 2 months or 3 months, to 6 months, the fertility is reversed.
Okay, so it's reversible.
Yeah, it's
reversible.
So
it's very, very tiny chances.
Yeah, it suppresses the fertility. The purpose of the family planning is to suppress the fertility, so that the purpose of the family planning is served.
Yeah.
So when someone is taking out that family planning method like DMP or Kapati or IUDs, then there is a lagging time after which the fertility will be there.
Okay, okay. I believe, Laura, you are pleased, or you are okay with that answer right there. Dr. Mohamed, you wanted to tackle the issue on women and the struggles that women face, the women who are not able to conceive. You wanted to touch on that.
Okay, so there are several issues a woman undergoes. First of all, we have emotional distress. This woman would be sad, would be anxious, would be depressed as to why she's not able to achieve pregnancy. She could feel inadequate or as a failure because she's unable to conceive. There are issues with relationship strain. So her relationship with her partner will be quite affected. And then it is time consuming, going back and forth to the hospital, trying to look for a root cause as to why you are not conceiving. Then the amount of money that you spend on treatment of these investigations, and also maybe when you find out that at the end of the day you are infertile and you think of doing assisted reproductive therapy, that is sort of IVF, then the cost implication would be high. The side effects of the treatments that you are getting also would be detrimental, and the impact on self-esteem. Definitely the woman would feel low. So those are a few issues the woman would really undergo.
Okay.
Thank you.
Let's get into the big question. Is infertility reversible? And maybe Dr. Rajesh, you may help us talk about this. If you may just touch on some of the assisted fertility options that are there for a woman or a man who has been labeled infertile.
Whether the infertility is reversible or not, it depends what causes infertility. Now, say for men, if he is infertile because of varicocele, and now varicocele is a condition where the veins around the testis, they get dilated, and that can heat up the testis. So that will lead to lower sperm count and motility. So now if the varicocele is the reason for low sperm count that is leading to infertility, then repairing the varicocele can reverse the fertility. Now, but if the infertility in men is because of the infection in the testes, or say if there is a genetic reason for infertility, then infertility is not reversible. Then he have to take help of the ART, that is IVF ICSI. In the same way, if the infertility causes erectile dysfunction, then some medical or any medical condition leads to the infertility, then correcting those medical conditions can make it reversible. Now for women, if the reason for infertility is say for fibroids or any anatomical causes that leads to infertility, now if that fibroid is removed, then it can be reversible. If the cause of infertility is tubal blockage, and which is not infective in reason, then unblocking those tubes can reverse the fertility. But that can help in just in 20-30% of the cases of those women who have fallopian tube blockage. In the same way, if the any ovulation is any hormonal disruptor is there, like obesity or any intake of any fast food or any other condition that leads to hormone imbalances, and if the lifestyle changes and modifications are done with certain medicines, then that can reverse a bit the infertility. So these are the things. Now the questions: what are the options for the infertility? Again, that depends what causes infertility. So as a fertility specialist, the first motive is to help the couple without the expensive options, which are the IVF and ICSI. So if a couple are young and the cause of infertility are simple or subtle one, then that can be managed by lifestyle modification or by simple medicines or even IUI. But if the problem is severe, that demands IVF, then IVF may only be the solution. So more or less the treatment options left with the options who are suffering from infertility are the IUI or IVF and ICSI, and sometimes even advanced IVF or ICSI options like doing the genetic testing of the embryo. Like this can help someone who are having repeated implantation failure or say repeated pregnancy losses. There's some other ART options, infertility treatment option as well, like surrogacy or donor egg. So these are all options that we have. So the modern sciences has helped most of the infertile couple, and if a right direction is taken and the treatment course is the right direction of the treatment is taken, then I think 99% of the infertile couple can get a baby.
Okay. You mentioned one of the cheapest ways of tackling infertility is lifestyle. What maybe are some of the lifestyle tendencies that you would advise some of us or someone who's looking into conceiving to follow in order for them to maintain their fertility or maybe not lose their fertility?
Now this problem, infertility, can be a cascade of the events that can happen and finally leading to infertility, like hypertension or diabetes. Now when someone is hypertensive, then he will be taking a medicine. Now that can lead to poor sexual performance, erectile dysfunctions, and that can lead to the infertility. Now hypertension is a result of lifestyle sometimes, obesity, and again obesity is a result of improper lifestyles, like improper food intake or lack of exercises. Now obesity will lead, like as I said, there is a fat accumulation, estrogen and low testosterone, and then low sperm count. That obesity is one thing. So you have to be, you have to maintain your body weight and that you don't have to be too obese. Like the BMI has to be maintained below 25, or say below 30 is okay. In the same way, smoking. Smoking, either in men or women, that can lead to damage in the gametes, I mean sperms or the eggs. So these lifestyles are important to maintain the proper quality of your gametes. And then one of the cause of infertility is sexually transmitted disease that can infect your reproductive organ.
Oh, there are sexually transmitted diseases
so that will also come under the lifestyle, like not having a hygienic life or hygienic sexual practices.
Maybe you can touch on some of these STIs that can cause someone to have an issue with the fertility.
One of the most common reasons for infertility in women is the chlamydial infection. Like the chlamydial infection of the fallopian tube is one of the major reasons of the fallopian tube blockage. Then infection in the womb lining can cause endometritis, and that can you can ovulate. The fertilization process can happen in the fallopian tube, but the implantation process, which has to happen in the womb lining, will not happen. You know, so these things are there.
Okay, IVF is something that Dr. Rajesh has mentioned as a way of assisting couples that cannot conceive, even couples that are totally, you know, infertile, you know. So if you can just start by the definition, what is IVF?
So this is a treatment option for couples struggling with infertility, whereby there is controlled ovarian hyperstimulation and retrieval of eggs. So these eggs and the sperms are taken to the laboratory where fertilization takes place, and then the embryo now is reimplanted back into the uterus of the woman. So basically that's the definition of IVF.
Yeah. Does this mean that can we have someone else? Can you use someone else's egg? I mean, I really want to understand it.
Yes, you can. You can use donor eggs, especially for the elderly patients. Say a woman who is in her 45 or 50 years of age and has low sperm, I mean egg quality. So that would lead for her to use a donor egg or a donor embryo.
Yeah, for someone who is infertile and it is irreversible, as you mentioned, there are those that there's really not much that can be done. You say that IVF can help this person have their own child. Yeah. Whereby they use someone else's maybe sperm.
No. What I was saying, like the IVF is not only about using someone else. It's IVF is primarily, in 80% of the time we do IVF on their own eggs and sperm.
Okay.
But someone who doesn't have a good quality of egg, say after the age of 42 or 43, the quality of the egg, the chances that someone gets healthy child with own egg is just around 1 to 3%. Or even sometimes there may be a case where there is a repeated IVF failure, or even if she is younger. In those conditions, we can advise them to go for the donor egg. Or if there is say some genetic cause, genetic reason, where there is a repeated pregnancy losses. In those conditions also they can take help of the donor services.
Okay, and when you were talking about that, I just remembered the issue of freezing of eggs for women. You know, I feel like in the society we live in right now, most women are career oriented, and they feel like if I get pregnant right now, maybe it might interfere with my career and where I am headed. So what are the options of freezing eggs, and how effective is that, and would you advise a lady who probably isn't ready to get pregnant and they are aware of that biological clock, so they feel like, let me just freeze my eggs, when I'm ready at 45 I'll go take it and get my child?
Yeah, this is a good question. Now one can get her egg freeze at a younger age. What I would advise to get freeze before the age of 32, and to get egg freeze in enough number. Because, but what one has to understand, that no number of egg would guarantee you a baby.
Okay.
Because even if you freeze the egg, and now still you have to rely on future whether you will have a successful IVF or not. So that is not a guaranteed. But that will certainly preserve your fertility till you want for the pregnancy. But that is not a guarantee. So the best thing is to balance the career and the personal life. You know, the life is like not like a one vehicle. It's like a two like a train, where you have to, every party plays equally role in leading the life. So career, the parenthood, they can go side by side. But if that is not possible, this egg freezing is still an option.
Okay.
Now the question is how many eggs to be preserved, and when to consider for the pregnancy. Some may be waiting for the right partner to come. So if you have a partner, it's best to freeze the embryo than egg.
Okay.
If you don't have a partner, then you can consider freezing your egg. Why is this? Because the embryo has a better capacity to revive after once you thaw that freezing and thawing process. The embryo has a better capacity. But egg, they are a bit poor on that. In percentage, I would say like embryo will survive 95% of the time, and the egg would survive around 60 to 70% of the time. So that means if you are freezing 10 egg, and when you are using it in future, say after 10 years, then out of 10, 6 may survive, so 4 may not survive. Then that brings a risk. So it's better to discuss with your fertility specialist about the number of the egg to be frozen. And so what matters is at what age you freeze the egg. Now, because that will determine the quality of the egg. Now, if the quality of the egg is not good, no matter you freeze 30 or 40 egg, that is not going to work.
Okay. Oh, I've learned something new right here. When you talked about it's easier, you would rather freeze an embryo rather than just an egg. Oh, okay. My ladies, I hope you have heard that. Okay.
That's a myth, you know, that someone thinks like if I go for egg freezing and if I go for IVF even at 45, so the success is your cert. That's a myth.
It is a myth. Yeah. We're going to get into some of the myths of IVF and some of the, misconceptions around that. But before we get into that, the first baby born of IVF was born in the year 1978. That was the first successful IVF baby. Right here in the country, just how effective has IVF been so far, being that you work at Fertility Point, Kenya, and this is something that you undertake?
IVF have been effective in solving their problem of infertility. It's not only when we say IVF, it's not just a IVF, it's like other form of infertility treatment as well, like IVF, ICSI, or donor program or surrogacy program. They all help. They have all helped the couple to have a baby. Now, it all depends on the consistency of the treatment, because one cycle of treatment may not be enough. So 40 to 50% of the time of the couple, they get conceive in first attempt, but remaining they may require second or third or even fourth attempt of IVF. Now the direction of the treatment the direction means whether you are using your own egg or the donor egg or the surrogacy, and their indications are different in the case. That also matters, that how soon the success will be there. Now, if you are somewhere near 45 years and you still persist using your own egg, then you may not be successful even after 3, 4, 5 year attempt, or never be successful. But if you go for a donor egg at that point of time when you are 45, and you may get successful in the very first attempt.
Okay. All right. Dr. Mohamed, if you may talk about some of the stigma around IVF.
So there are ethical issues involved, which are being fertilized, and development of several embryos. So the question is, what do we do with these extra embryos? So that's the major issue. And then there is, of course, there is religious objection, whereby people always relate to natural methods of conception rather than the IVF. Then there is the financial burden involved, whereby it is believed, of course, like the rich or the one who can afford will be able to undergo the IVF. So there are social stigma also, as in people will say, why go that way instead of just doing the normal way.
Yeah.
So there are misunderstanding also and misconception in that people always believe that if you do IVF, then you are guaranteed at the end of the day to conceive and carry the baby up to term, but which is not necessarily the case. So yeah, those are the few I could talk about.
Yeah, you've mentioned costs. Maybe Dr. Rajesh, you may help us talk about that. Just how expensive, okay, expensive is relative. What is the cost of IVF in the country?
It will range from somewhere between 400 to 500,000 shilling. So now that depends on between center to center, but it's roughly beyond that. So one should budget for around $500,000 for one round of IVF.
Around $500,000 for one round, yeah. And you're not guaranteed that it's going to work on the first round. Wow, that may be a lot. You know, I can imagine someone who has really put their money together to go for it, and then on the first round it doesn't happen. Could there be a reason why it may not work? Mainly?
Yeah, mainly it is a God factor. You know, how we are like a farmer, you know.
Yeah.
So this is also reproduction. Even a farmer does a reproduction process there in the farm. So we work with the egg and the sperm. We fertilize it in the lab, and then we put those embryo in the womb lining, in the uterus, to get it implanted. Just like a farmer, what he does, he works with the seeds, he works with the soil, which is like a uterus, seeds is like a embryo, and then he sows the seeds, and then he rests lives on God, whether, I don't know, he's not sure whether it will germinate or not. So if he needs, say, 10 plants, he will sow 20 seeds. Yeah? That process of implantation is beyond the scope of the science now, right now. It may get improved in future, but right now that factor is under the control of God. That's why we always say that the success rate is around 50 to 60, 70% with one attempt.
50 to 60 percent
with one attempt.
Okay.
Even with transferring good quality of embryo in a good uterine environment.
Okay. As we wind up, could you touch on some of the side effects of IVF? Because everything has, their side effects.
Yeah, the medical side effects of IVF can be related to the drugs and injections. It can be like hyperstimulations, where when we give injections to develop more eggs, and then that can lead to like a hyperstimulation like situation where there can be a gastric upset or bloating, but these are the minors and they quickly goes off within a week. So far the risk of hyperstimulation has gone down because of the modified stimulation techniques, so that's not an issue now. Sometimes there can be a risk of infection because of this continuous manipulation with the uterus and cervix. Otherwise, there's no major complication of IVF.
Okay, there's no major complication.
The one that twin pregnancy, they say twin pregnancy or triplet, but some consider twin as a bloom than a complication, you know.
Okay.
So that's not.
All right. So Dr. Rajesh has said sometimes it's all up to God. And Dr. Mohamed, I don't know if you have encountered maybe a lady in your field, you know, where someone may have been termed as infertile, but later on they come and tell you, you know what, I was able to actually conceive and I have a baby and I did it naturally. Have you encountered such?
Yes, it is possible, because there are certain percentage of unexplained cause of infertility. Sometimes you will do all your investigations for both the couples and find that everything is working well, but for some reason they can't really conceive. But as he said, it is up to God. It will take its own time, and definitely when the time is right for you, you will conceive.
All right. If you do believe in miracles, then miracles do happen.
Let me add on this.
Okay, as we finish because of time.
There are the studies where 10% of the couple, they conceived after a failed IVF. So there are datas that pregnancy can happen after failed IVF.
All right, so they went the IVF way, they paid all that money, it didn't happen, but now
the very next cycle they conceived.
Okay, we are running out of time. We need to wind up this conversation. Thank you so much for joining me on this conversation, and thank you for getting into it and allowing us to understand it even better. Now, on behalf of the team that made this possible, from our directors, producers, camera operators, we say thank you for watching, and do have a lovely day. We meet again not next week. Ni kama nimejipatia holiday. Tomorrow, same time and place.